Private hospitals have been in the spotlight over what is termed as exorbitant charges in managing and treating COVID-19 patients. Some hospitals have gone as far as holding onto the dead bodies until relatives clear the medical bills. This prompted the Parliamentary COVID-19 Task Force to summon the proprietors of private hospitals for an explanation. The proprietors, who admitted to charging high fees, claim on average they spent 3.5 million on each COVID-19 patient for basic intensive care unit treatment.
Talk about parental nutrition. Most of these patients can't feed. So you're supposed to feed them possibly through the vein and many other drugs, okay? By the way, the honorable member talked about an injection that costed 3 million. They are actually those that can cost up to 7 million shillings. 7 million shillings, and they are needed for management of COVID.
The fees include 1,155,000 on drugs, 805,000 on human resource, 560,000 on bed and ventilator, 385,000 on personal protective equipment, 315,000 on laboratory, 245,000 on administration, and 35,000 on imaging. However, MPs on the task force still claim these fees are unjustifiable.
If you walk in any private clinic today with COVID, as long as there is a word COVID, even if you are not on a ventilator, you will not go without paying 300,000 or 500,000, just walking in.
It has even gone to the extent of claims that even car logbooks and land titles have to be issued in order to clear bills. So we want to know whether is this a practice that is ongoing?
That some of these patients that you keep in the ICU, in fact, they die earlier, and the announcement is brought in later. Is this happening? Is it true?
I don't know any private facility that does that. But when a patient has been placed on a mechanical ventilator, what criteria does the medical team use to determine death? My medical colleagues will tell you that yes, there are actually guidelines that are utilized in order to determine that.
The proprietors argue that the costs are driven by high water and electricity bills, oxygen and limited number of health specialists, among others.
So if they can list what you think government can provide, make a list of what you think government can provide, whether you're saying in this period of the pandemic, if they can waive off the electricity bills, water, so that we know what you think government can do to help you.
To them, this health crisis can only be solved by massive vaccination of at least 20 million out of the 45 million Ugandans for the country to achieve herd immunity.
So while the government is vaccinating through their own providers and some private facilities, I think we need to increase coverage. This talk is mainly looking at case management, which is something which we are not going to manage to deal with in the short term.
When you talk about vaccination, we are talking about less than 900,000 people. But how much money have we spent? And how much money are we going to spend? And how much money should we spend to have 21 million people vaccinated?
Why we don't have so many choices here? And if private sector is ready to import and to improvise these vaccines to the community, I think we should allow them. We should allow all those people. Yes, government can be there to monitor the prices. There is no issue.
According to the proprietors of these private hospitals, they are choking on loans, which they want government to help them speak to commercial banks so that they can be rescheduled. They also want to access cheap credit from Uganda Development Bank if their costs of operation are to go down. Ziwa NTV at Parliament.